Hello everybody, this is Dr. Lewis and I am recording a final exam review session. We're going to spend a couple of minutes looking at the concepts from Module 1 through Module 5 with some slides that have practice problems. First, let's talk about the NUR 150 final exam. It is a 40-question exam covering all 5 modules and you will have 90 minutes to complete the exam. The 40 questions are mostly fill in the blank with a few multiple choice questions. There are approximately 8 questions for each module of content that we've reviewed. The time limit is 1 hour and 30 minutes, and it covers all 5 comprehensive modules. Let's start with Module 1. In Module 1, we spent time discussing medication safety and talking about oral medications. Here are some key points to remember that you should go back and review. Remember your rights of medication administration. There are 10 now, but some sources name 12 or 6. ATI names 10 rights. Remember, there's different types of prescriptions, meaning there can be a routine prescription. There are PRN or give as needed prescriptions. Prescriptions can be ordered stat, or prescriptions can be ordered as a one-time dose. Remember the components of a prescription, meaning that when a medication is ordered, there needs to be a medication name, plus a dosage, plus a route, plus a time frame. If it's a PRN prescription, there also needs to be parameters included with the PRN medication, meaning there needs to be a reason why you would give the medication. Review prevention of medication errors. We looked at systems of measurement with conversions between 12-hour and 24-hour clocks. We looked at metric conversions, and we looked at conversions between metric and household measurements. There are some key safety topics that we looked at in class. Number 1 was the correct placement of zeros. And remember, you need to have a leading zero when you have a decimal point. For example, 0.6 rather than just 0.6. And you do not want to have a trailing zero, right, like writing 12.0. Medication abbreviations like PO, IM, sub-Q, things like that, we also reviewed. And we also spent some time talking about extended release medications. I placed a medication label on this PowerPoint to remind you that generally an extended release medication will have an XR or an SR following the name. It often will say extended release capsule or sustained release. We also discussed medication calculation of oral medication dosages. The way this is going to work is that I am going to review through the problems on the page relatively quickly. My suggestion would be to pause the recording to work through the problems within each section and then hit play again when you've got your answers, because I'm going to move right through them continuously. Up top, I listed the components of a medication prescription. And like I said, a prescription contains a medication, plus a dosage, plus a route, plus a time frame, plus any associated parameters if it's a PRN medication. The question is asking you which medication of the 4 provided answer options needs to be clarified. And your options are augmentin, morphine sulfate, rosuvastatin, or aspirin. Take a minute to look at these 4 and determine which one of those needs to be clarified because it's missing one of the required components. If you have chosen number 3, you are correct, as it is missing a route. This prescription has a medication, a dosage, and a time frame, but we don't know how that rosuvastatin is going to be taken. The next section below that is medication abbreviations. Again, I would like you to pause and make sure you know these medications because I'm going to review them rather quickly. First, we have BID, which stands for twice daily. QID stands for 4 times a day. TID stands for 3 times a day. PO stands for by mouth. IM stands for intramuscular. AC stands for before meals. So for example, insulin is ordered for AC and HS. So you would expect to administer insulin before meals and then HS is at bedtime. Those are very common medication abbreviations that you should be familiar with. On the right side of the page, remember your rules of rounding. Generally, most questions are going to have the rules attached to the question. However, the general rule of thumb is if the amount is less than 1 milliliter, you will round to the nearest tenth, or the nearest hundredth, excuse me, if need be. If the amount is greater than 1 milliliter, you will round to the nearest tenth. In the first section, take a minute to round each number to the nearest tenth. The first answer is 1.7. The next one is going to round up to 9.9. The next one, rounding to the nearest tenth, will round to 7.4. The one below, we're going to look at rounding to the nearest hundredth. 10.786 is going to round to 10.79. 4.589 is going to round to 4.59. 7.895 is going to round to 7.9. This is because the 5 will push the 9 up to the next digit, which will push the 8 up to a 9. To repeat, be sure that you're comfortable with those rules of rounding. On your module exams and your quizzes and the NCLEX exams, the NCLEX will tell you, the questions will tell you how to answer. But in nursing practice, you will use these rules when calculating medication dosages. So even if you're given these rules in exam situations, you still need to understand them when you're actually measuring out medications. Let's look at systems of measurement. So for example, time conversions. I don't have any practice problems on these for you because I think you're pretty comfortable converting between 24 and 12-hour clocks. Remember, when you're in 24-hour time, you do not use a colon between the first 2 digits and the second 2 digits. With metric conversions, remember there's 3 decimal points or a power of 1,000 between kilogram, gram, milligram, and microgram. That means if I'm going to move from kilograms to grams, I will move the decimal point 3 spaces to the right. If I'm going from grams to kilograms, I'm moving the decimal point over to the left 3 spaces. Remember, 3 decimal points or a power of 1,000th between those units of measure. Let's talk about household conversions. First, the conversion of pounds to kilograms. Remember, you have 2.2 pounds for each kilogram of weight. Tablespoon to milliliters, there are 15 milliliters for each tablespoon of measure. Teaspoon to milliliters, there are 5 milliliters for each teaspoon of measurement. Remember that 1 fluid ounce is 30 milliliters and that a cup is equal to 8 fluid ounces, which is equal to 240 milliliters. Those are very common conversions that you should know. On exam, you can be asked to calculate problems, and you will need to calculate how many ounces of intake a client had based upon what the client drank. And you might see a client having 4 ounces of orange juice, and you need to understand what that means in milliliters. Finally, in Module 1, you have calculation of oral medication doses. And again, you would want to pause and work these out before I go through them. Number 1 is furosemide 60 milligrams PO daily. Your available supply is furosemide 40 milligrams tablets. How many tablets will you administer? The number of tablets that you will administer is 1.5. Number 2, the order is for prednisone 7.5 milligrams PO every morning, and you have available 5 milligrams scored tablets. You're going to administer 1.5 tablets. Number 3, the order is for acetaminophen 975 milligrams orally, and your available supply is of 325 milligram tablets. How many tablets are you going to administer per dose? The correct answer is 3 tablets. Number 4, the order is for ibuprofen 600 milligrams PO TID. You have available ibuprofen 100 milligrams per 5 milliliter suspension. I had to pause for a minute, so apologies because I don't remember where I last left off. Ibuprofen 600 milligrams PO TID. Available is ibuprofen 100 milligrams in a 5 milliliter suspension. How many milliliters will you administer per dose? and you will administer 30 milliliters per dose. And the final one, amoxicillin 500 milligrams PO every 8 hours. Your available supply is amoxicillin suspension, 250 milligrams per 5 milliliters. How many milliliters will you administer per dose? The number of milliliters you will administer per dose is 10 milliliters. So if you are comfortable with oral dosage calculations, feel free to move on. If not, you may want to look back over your module in ATI and review the content and practice problems again. Make sure that you're able to convert between household and metric measurements and convert within the metric scale. So let's move on to Module 2. Module 2 is a mix of a lot of different things, covering both injectable and powdered medications. Experience has proven that calculation of injectable medications is not too complicated, but that powdered medications can be challenging, mostly because of the challenging of finding key information on the medication labels. Remember, there are 3 main types of injections, not including IV. Intradermal is a shallow injection into the dermis layer of the skin. Has a very narrow angle of the needle when it's introduced into the skin. Think about if you've had a PPD done. This is an intradermal injection. Subcutaneous injections are the most common injections. You give subcutaneous injections frequently, especially with insulin and heparin. A subcutaneous injection is generally administered via a much wider angle. For example, you would probably have a 45-degree angle of the needle. And finally, there are intramuscular injections, which are less common, although most vaccines are IM injections. It's a deep injection into the muscle tissue. And remember, the most common site for the IM injections is not always the preferred site. The preferred site for IM injection is the ventrogluteal or in the side of the hip. However, the most common site that you see utilized with most IM injections is the deltoid. I'm going to talk a little bit about syringe selection on the next page, and I'm also going to talk about reconstitution a few pages from now. Let's review syringe selection. There are 2 main concepts you need to consider when choosing which syringe to use. Number 1 is the amount that you're giving and need to consider the route of the medication you're giving. And the reason I'm saying that is the first syringe you see here, that's a tuberculin syringe. The tuberculin syringe has a very short and fine needle, and you would not be able to give an intramuscular injection using a tuberculin syringe. It is not designed for that. The needle on it is not going to support an IM injection. With that in mind, let's look at the practice problems below. Your first practice amount is 0.5 milliliters to be given intramuscularly. If you need a minute, go ahead and hit pause and determine which syringe is going to be best to introduce this medication. The best syringe for 0.5 milliliters IM is the 3 milliliter syringe because it has a needle that is built to deliver an intramuscular injection. The tempting answer is to pick the top syringe, but that's not the appropriate syringe because the route is IM. So when you are selecting a syringe for medication administration, remember you need to consider not only the amount, but also the route that is being given. Your next practice amount is 1 milliliter subcutaneous. Looking at the syringe options, you're going to use the top syringe. Subcutaneous injections are often given using tuberculin syringes. That's an appropriate syringe and needle to use to give that injection. The third amount is 4 milliliters IV. If you chose the third one, you would be correct. That is the correct amount to deliver 4 milliliters through the IV line. On the right side of the screen, let's look at some injectable dosage calculations. And you're going to use whichever rules you're using to decide to calculate these dosages, whether that be ratio proportion, desired over have, or dimensional analysis. First one. Morphine, 4 milligrams IV every 4 hours, PRN pain. You have an available supply of 10 milligrams per milliliter, and it's asking how many milliliters will you administer per dose, round to tenths. The correct answer is to administer 0.4 milliliters. The next is a reconstitution problem. We're going to use some of those rules. The order is for cefazolin 1 gram IV. We have a powdered vial of 1 gram. The reconstitution on the label says to add 2.5 milliliters of sterile water to yield 330 milligrams per milliliter. And remember, those are magic words for reconstitution, either the words to yield, or the words final concentration of, or the words each milliliter contains X milligrams after reconstitution. So with that knowledge, how many milliliters would you round up for the full dose? Round to a whole number. The correct answer is I would draw up 3 milliliters to get that dose. The next order is for regular insulin 12 units subcutaneous. The available regular insulin 100 units per milliliter. How many milliliters would you administer? We are actually going to use an insulin syringe and you're going to draw up 12 units, but in fluid measurement, if you're asked to do that, it would be 0.12 milliliters. Number 4, heparin 5,500 units subcutaneous. Available is heparin 10,000 units per milliliter. How many milliliters will you administer? Round to hundreds. The correct answer is 0.55 milliliters. Let's look at the final one. Ketorolac or Toradol, 45 milligrams IM. The supply dosage is Ketorolac 60 milligrams per 2 milliliters. The first question asks, what is the maximum volume to administer in an IM injection? Okay, and all IM injections should be a volume of less than 3 milliliters. The next question is, how many milliliters will you administer? And the correct answer is 1.5 milliliters. Based upon the information, is that a safe volume for a single IM injection? Based on the information given here, the answer is yes. That is a safe volume to administer for that injection. So that's generally not the one that causes you problems. Let's look at some medication labels. These tend to be the ones that make you feel a little challenged. To be clear, reconstitution is not a bad word. It seems like it, but it's not. It's kind of like those words, select all that apply. Those are not bad words either. They're just words. Let's look at these two labels and work through the questions. And the key with these is to take your time, look at each label one at a time, and read what the question is asking. I promise the information is there. Take a deep breath every time you need one. The first label is Amoxil. It's an oral medication, and it provides good experience with label reading and reconstitution. Let's look below the label and look at what information the question is asking for. The first question is asking about the amount of diluent. If we look here to the small print on the side, I'm circling it with my arrow here, the amount of diluent is provided and it's highlighted in black. According to the label, the amount of diluent that we're going to put in this bottle is 78 milliliters. Because it's a suspension, we need to shake it to make sure that the powder suspends prior to measuring out the dosage to administer. The next question is asking about the final concentration, which if you keep reading through it, is going to be 125 milligrams per 5 milliliters. An order is provided to give 500 milligrams PO, and the amount that I'm going to give for this is 20 milliliters. Make sure that you got those answers. Look back at the question, look back at the label, and make sure you understand where I found that information. Let's move to the label on the right. And yes, I apologize, but you're going to have to turn your head to look at this. The medication is Nebsen or tobramycin. And the first question is asking is the amount of diluent to add to the powder. On the label, it says that you need to add 30 milliliters of sterile water for injection to provide a solution containing 40 milligrams of tobramycin per milliliter. It also says to shake well. The medication order is for 400 milligrams IV, and I want to know if I need to draw up 400 milligrams from this vial, how many milliliters am I going to need to withdraw? You've got all the information that you need to be able to put this into a desired over have, dimensional analysis, or ratio proportion. The amount to withdraw from the vial is 10 milliliters. Sometimes we're going to ask you other information that's contained in the label. In this case, we're asking, can it be used 48 hours mixing if refrigerated? According to the label, it must be stored refrigerated and used within 96 hours. So, the answer is yes. Do not fall for the next words which say, if kept at room temperature, used within 24 hours. So make sure you pay attention to what each label is saying. Let's move on to Module 3. In Module 3, we looked at parenteral medications. There are three main calculations that we looked at with parenteral medications. We looked at milliliter per hour calculations. We looked at intermittent IV piggyback calculations, also called secondary IV infusions, generally given in minutes rather than hours. And we looked at drops per minute calculations, using drop factors for when you do not have an electronic IV pump available. And of course, you know on the next page, I've got a bunch of practice problems to do exactly that. Let's work through these problems. First up are milliliter per hour questions. Remember to round IV medications up to whole numbers unless otherwise instructed. If you want to work through 1 through 4, you want to hit pause now, do all the math that you need to do, and then hit play so you can review the answers with me. The answer to number 1 is going to be 125 milliliters per hour. The answer to number 2, 250 milliliters over 6 hours, is going to be 42 milliliters per hour. The answer to number 3, lactated ringers, 750 milliliters over 5 hours, their answer is going to be 150 milliliters per hour. And then the final one, D5 half normal saline, 500 milliliters to infuse over 12 hours, and your infusion rate is going to be 42 milliliters per hour. Hope you got those. Generally, this is not an area where you struggle. Moving on, we're going to do the drops per minute calculations. And remember, the equations for drops per minute in volume is volume in milliliters over time in minutes times the drop factor. Let me repeat that. The equation for drops per minute is volume in milliliters over time in minutes times the drop factor. Same rules apply. Hit pause, work through numbers 1 through 4, and then hit play and we'll go over the answers. Number 1, infuse 1,000 milliliters of normal saline over 8 hours with a drop factor of 15 milliliters. Your answer is 31 drops per minute. Number 2, 250 milliliters over 3 hours with a drop factor of 60 drops per milliliter. Your drop rate in drops per minute is 83 drops per minute. The next one, we already gave you minutes. That's a happy little coincidence. The order is ceftriaxone, 30 or 50 milliliters over 30 minutes with a drop factor of 20 drops per milliliter. Your drops per minute rate is 33 drops per minute. And the last one, lactated ringers, 750 milliliters over 6 hours with a drop rate of 10 drops per milliliter. Your drip rate in drops per minute is going to be 21 drops per minute. If you've done well with that, let's move over to the right and look at milliliters per hour for time that's given in minutes. Hit pause, work through 1 through 4, and then hit play and we'll go over the answers together. Number 1, magnesium sulfate, 2 grams to infuse over 30 minutes. My infusion rate in milliliters per hour is going to be 1 milliliters per hour. The next one is ketorolac, 30 milligrams in 15 milliliters to infuse over 15 minutes. The correct answer is 60 milliliters per hour. Vancomycin, number 3, 250 milligrams in 100 milliliters to infuse over 90 minutes. What is the infusion rate in milliliters per hour? The correct answer is 67. And the final one, amiodarone, 150 milligrams in 100 milliliters to infuse over 30 minutes. And your drip rate is 200 milliliters per hour. I hope these worked out well for you. If it did, we're going to move on to everyone's favorite weight-based calculations. As always, this is an area where if you find you're struggling, go back to the ATI modules and work through them again and work through the practice problems again. The main concept with weight-based calculations is remembering to read the question. Weight-based calculations comprise a range of items. You will be calculating single weight-based dosages in milligrams per kilogram. You're often looking to see if an ordered dose is a safe dosage to administer for someone who is that weight based on a range of safe dosages. You may have to determine daily total medication requirement. Okay, I've got 4 different weight-based practice problems to work through. So I'm going to move on to the next slide for them now. Number 1, remember to pay attention to your weights. Some of these weights will be provided to you in kilograms and some are going to be provided to you in pounds. Remember that with multi-step dosage calculations is first you look for what the question is asking, and then you ask if you need to do any conversions. So we look at the weight and we see it's in kilograms already. It's very easy to get in the habit of assuming that we're going to give you the weight in pounds and that we want you to convert. That is not always the case. Don't assume, read the question. What we want you to do the most is to pay attention to the information that we're giving you. Number 1, a child weighs 18 kilograms. The order is amoxicillin 45 milligrams per kilogram per day, divided every 12 hours with a safe dosage range provided. First step, let's look at the questions that are being asked. It's going to ask for the safe daily dosage range and the total the daily dose ordered and whether or not that dosage is safe and how much the child will receive per dose. Second step, do you need to do any conversions? No, the weight is provided in kilograms and the safe dosage range is in milligrams per kilogram. Same thing with the order, it's in milligrams per kilogram per day. First question, the safe daily dosage range for this child is going to be 360 to 900 milligrams. The total daily dose is going to be 810, which is just 45 milligrams per kilogram per day multiplied by 18 kilograms. Then you compare the ordered dose to the range and ask, is the ordered dose safe? Yes, the ordered dose is safe because it's falling within that range. How many milligrams per dose will the child receive? That means we have to go back up to the question because up to this point we've just been looking at daily dosage range. Now we're looking for a single dose. Let's look at our time frame and it's every 12 hours. Then you have to say, well, how many times in a day is 12 hours? It is twice. So you have to take the 810 and divide it by 2 for a dose of 405 milligrams. I hope that went well for you. Let's move on. Number 2, a patient weighs 154 pounds. They have an order for enoxaparin, 1 milligrams per kilogram, subcutaneous every 12 hours. The available dosage is 1 milligram per milliliter. First step, what is the question asking? And this one's a little different because it's not asking about a dosage range. It's just giving a dosage orders in milligrams per kilogram, and it's asking how many milligrams per dose should the patient receive. Second, do you need to do any conversions? If we look back up, we see the patient's weight was given in pounds, and the order is in milligrams per kilogram, so we need to convert. The patient's weight in kilograms is 70 kilograms. How many milliliters or how many milligrams per dose should the patient receive? It's going to be 70 milligrams. The next question is asking how many milliliters will you administer using your available dosage of 100 milligrams per milliliter. And you're going to deliver 0.7 milliliters to the client subcutaneously. The total daily dosage in milligrams per day, remember, when you add that per day, we have to think about what that means. I'm giving it every 12 hours, and that means I'm giving it twice a day. I've got to take my 70 milligrams and multiply it by 2 times daily for a total of 140 milligrams in the daily dose in milligrams per day. If you got that, let's move on to number 3. This is a toddler who weighs 12.5 kilograms. They have an order for acetaminophen. The safe dosage range is 10 to 15 milligrams per kilogram per dose every 6 hours. The question is asking, what is the safe dose range for this child? The first question to ask yourself, what is the question asking for me? It's asking about a single dose range. Let's look back at the question. There is a safe dose range that's given in milligrams per kilogram per dose. The next question is, do I need to convert anything? No, we do not. The child's weight is provided in kilograms. That means you can go ahead and apply the math that I know you know. It determines the safe dosage range. The single safe dosage range for this child is 125 to 187.5 milligrams. The next question is the ordered dose safe? The ordered dosage is 180 milligrams, which is in the safe dosage range. The next question is not applicable because it says if it is not safe, what is the maximum safe dosage for administration? Well, it's safe, so we're just going to say NA. Let's move on to question 4 because you just owned that question. In number 4, the patient weight is provided as 95 kilograms. We have an order for ibuprofen 8 milligrams per kilogram orally every 8 hours with a maximum daily dosage of 2,400 milligrams per day. There's quite a lot of information provided here. I've got a single dose ordered, and there's a maximum daily dose. Let's look at what the question is asking. It's asking about milligrams per dose being ordered. The next question is to ask yourself is, do I need to convert? No, I don't. The weight is provided in kilograms. So you can proceed directly to multiplying 95 by 8 times 8 milligrams per kilogram, and the total milligrams per dose is 760 milligrams. The next question in the problem is asking how many milligrams per day is the ordered therapy. We went from per dose in A to per day in B. The acetaminophen dose is ordered, the ibuprofen dose is ordered every 8 hours. How many times per day is every 8 hours? If you just said out loud 3 times per day, you are correct. 760 multiplied by 3 equals 2280 milligrams per day. It is the total daily dose within the maximum safe limit. The maximum daily dosage, if I look back at the problem, is 2,400. So yes, that is within the maximum safe limit. Now you just owned 4 weight-based practice problems. If you struggled with them, please go back to the ATI module and do the practice problems. Make sure that you go over the practice problems and give yourself as much practice as you can so that you're comfortable with reading the questions and asking yourself every time, do I know what the question asks? Do I need to convert? And then move step by step through the problem. Do not allow yourself to get overwhelmed by these questions. Module 5 consists of pediatric and critical care dosage calculations. These calculations represent applying many of the same lessons learned in the prior modules. Specifically, Module 5 contains pediatric calculations with pediatric fluid requirements, weight-based IV fluids, and then we talked about critical care infusions with large volumes of IV over minutes and continuous drug infusions. Let's review some practice problems, some with pediatric requirements and some with weight-based IV fluids. And then we're moving right on to continuous infusions. Remember, your pediatric fluid requirement calculations, think in terms of tens. You break the child's weight down into tens. Remember, you multiply 100 by the first 10 kilograms of weight, 50 milliliters by the second 10 kilograms of weight, and then 20 milliliters by the remaining weight beyond that first 20 kilograms. And if you don't know what I'm talking about, you need to go back to week 5 and review the content again. Let's review these 3 practice problems. Please hit pause if you haven't already done so, work out the problems, and then hit play and we'll go over them. The first problem asks you to calculate the fluid requirements for a child who weighs 14 kilograms. 14 kilograms is going to be 1,000 plus 200 because you break the weight down into 10 plus a remaining 4. 38 kilograms. I've got 1,000 plus 500 because I've got 2 tens, and then I've got 18 remaining kilograms that I'm going to multiply by 20 for a total of 1860. And finally, 25 kilograms. Okay, I've got 2 tens and a 5. So I've got 1,000 plus 500 plus 100 for a total of 1,600 milliliters for daily fluid requirements. Next, going below, let's review weight-based IV fluids. Remember the questions. Do you need to convert to kilograms? Always look at what the question is asking. Multiply the milliliters per kilogram times the weight in kilograms. I'm asking 2 different types of questions here, and it's asking you to employ 2 different types of math. Number 1, it says to infuse 0.9% normal saline at 12 milliliters per kilogram for a total of 10 hours. The child weighs 66 pounds. What is the drip rate in milliliters per hour? Do I need to convert to kilograms? Yes, you do. So you should have converted your 66 pounds into kilograms. From there, you take your 12 multiplied by your weight in kilograms to equal 360. So total amount is 360, and then you have to divide it by 10 hours. So your drip rate becomes 36 milliliters per hour. If you didn't understand that, go back and look at the problem again step by step. There's a lot of steps that happened before that answer appeared. Convert to kilograms. Once you convert to kilograms, multiply that by the milliliters per kilogram, and then look at the amount of time you have to infuse the amount of fluid. Second question. It's asking something different. It's saying to infuse D5W at 20 milliliters per kilogram for a total of 8 hours. For a child who weighs 88 pounds. What is the total amount of IV fluid the child will receive? This is asking you something different, so let's look and say, okay, it's asking me for a total amount of fluid. I've got a weight that I need to convert. So we do the conversion, 88 pounds becomes 40 kilograms. Going to take that 20 milliliters per kilogram per hour, multiply by the weight in kilograms to give me 800. Going to multiply 800, multiply by 8 hours for a total amount of 6,400 milliliters. The last set of questions consist of continuous IV medication infusions, or sometimes they're called critical care infusions. Remember your steps. What is the question asking? And do any necessary conversions first. Okay, I like to convert everything to what I need in the end. If I need milliliters per hour in the end, I need to make sure everything is moved to that. Make sure that all of your units are the same before you plug them into your equations. If my order is in milligrams, my available needs to be in milligrams. If my order is in micrograms, my available dose needs to also be in micrograms. Let's start with a heparin problem. The order states start heparin at 1,200 units per hour. I have an available dosage of 25,000 units in 500 milliliters of D5W. What is the infusion rate in milliliters per hour? The best way to do these problems is desired over half times quantity. I desire the client to have 1,200 units per hour. I have 25,000 units in 500 milliliters, and my drip rate is going to be 24 milliliters per hour. Number 2, nitroglycerin at 15 micrograms per minute. Available is 50 milligrams of nitroglycerin and 250 milliliters of D5W. Calculate the infusion rate in milliliters per hour. Remember your steps. What do I need at the end of the problem? And it's milliliters per hour. I already have milliliters, but other than that, the units in the problem are minutes, micrograms, and milligrams. So I've got some converting to do. I'm going to stay in micrograms because that is the dosage that is ordered. I'm going to take my 15 micrograms per minute and make it into hours by multiplying 15 times 60. I'm also going to take my supply dosage and move those milligrams into micrograms by making 50 milligrams of nitroglycerin into 50,000 micrograms of nitroglycerin. Once I have everything in micrograms and hours, I can then apply my desired over half times quantity. So your answer for your infusion rate for nitroglycerin is 4.5 or 5. Generally, you're going to round to the whole number, but with some continuous infusions, you would keep your drip rate in tenths. Pay attention to what the question is asking for in that respect. Did you get that one? I hope you did. Let's do the next one. Amiodarone to infuse at 1 milligram per minute. I have 360 milligrams amiodarone in 200 milliliters of D5W. And the question is asking, what is the infusion rate in milliliters per hour? Remember your steps. What is the question asking? So look back at the question. I need milliliters per hour. Do your conversions and then apply the math into the equation. The correct answer for this one is 33 milliliters per hour. Hope you got that one. Finally, let's look at the last one. The patient weighs 220 pounds. You have an order for an insulin drip at 0.12 units per kilogram per hour, and the supply dosage is 100 units in 100 milliliters. My first question is, how many units per hour should the patient receive? Apply the math to obtain an answer of 12 units per hour. The next question is, what is the infusion rate in milliliters per hour? Because I have 100 milligrams in 100 units in 100 milliliters, the actual answer is going to be 12 milliliters per hour. So that was a quick review of your 5 modules in NUR 150. I really appreciate your time and attention. Let's talk about some study strategies. You want to go back and review your core concepts. Okay? You need to do your safety fundamentals, calculation fundamentals, and remember your steps. Do practice calculations, work through dosage problems for each module type. Make sure you master those conversions. So much of what we do is with conversions, and if you do them wrong, then the rest of the problem becomes wrong. Especially be comfortable with those metric conversions. Remember, you've got that power of 1,000 between, or 3 decimal points places between kilograms and grams, grams and milligrams and micrograms. Make sure you review safety concerns. And remember your key focus areas: medication rights, calculation accuracy, weight-based dosing, IV administration, and error prevention. All of these are important focus areas, and we've covered them throughout the content of the course. Finally, remember, you've got this. Make sure you review all of the 5 modules thoroughly. Practice your calculations and remember your safety principles. I believe in you guys. I have enjoyed working with you this semester. On exam day, try to remember to get there early so that you're not flustered. Once you start, you've got 90 minutes. Bring your calculator, take your time reading each question carefully, and ask yourself, what is it looking for? If you get stuck, move on. Take a deep breath. Do not allow this test to get the better of you because you've got this. If you have any questions, please feel free to reach out to your instructors. Thank you, and have a great day.